one of the most difficult moments of Filipino parents is knowing that their children become pregnant at their young ages. They really don't have an idea that their children who sends them to school becomes pregnant and become a mother at a very young age. In this modern day and modern technology, the behavior and attitude of young people changes. They are losing their morale and the Filipino values that our great-grandparents teach us. The lack of knowledge of Filipino teenagers can cause them to fall into temptation and become pregnant at their young age. ASEAN member states, despite the decrease of total live births of teenage mothers aged 10 to 19 in 2016, 203,085 to 183,000 in 2019. The report by the UN says the Philippines top the regional list of Asian countries that continue to have the greatest number of teenage pregnancies. It also says that 1 in 10 young Filipino women between 15 to 19 years of age is already a mother. The first is lack of attention. It happens when there is limited processing capacity, which implies competition for attention. As human beings, we spend every waking moment paying attention to many things at the same time. Second is influence, the capacity to have an effect on the character, development, or behavior of someone or something. Number 3 is exposed to sexual contents like the websites and the apps and so on to other factors. Number 4 is, of course, by having sex or by the means of threat, by the means of needs such as money for daily needs like foods and so on to the other stuff. And lastly, number 5 is uneducated. The effects of pregnancy on the teenager included school dropout, health risk during and after childbirth, divorce, rejection by parents, stigmatism, and sometimes if the baby is unwanted, abortion occur. Conclusion and recommendation: the factors driving teenager pregnancies are complex and varied, and therefore require multifaceted intervention. Teenage pregnancy, a social dilemma, and young parents have to face huge humiliation and negative remarks from people. Teenage pregnancy is viewed as a social stigma, and teen parents have to bear bad reputation as the society treats them as outcasts and strangers. Teenage pregnancy is one of the modern society's evils and is rather alarming situation. Most countries, developed and underdeveloped, consider teenage pregnancy a social stigma, and it can have a devastating effects on teens' social life. Justification study shows that adolescents' pregnancy is an indicator rather than a direct cause of negative economic, educational, and health outcomes often attributed to it. For instance, young mothers are more likely to end up poor. I, along with a member of foreign organization established in the Philippines, which is Plan International, has to look for a brighter side in a solution for this specific situation. It can be best addressed as or through the use of psychology and law in the fields of science. First is psychology. The aim of the present study was to investigate the impact of teenage pregnancy on pregnant teenagers. Specifically, the study sought to determine whether or not pregnant teenagers experienced psychological distress during pregnancy. Another factors that contribute to their mental health is that we listen, we give advice and options to start to take a step for a new beginning of their lives. Second is law. Law, the systems of rules, which is particularly countries or community recognizes as regulating the actions of its members, and which it may enforce by impositions of penalties. We should further acknowledge and restrict the law and punish those who hasn't follow and abide the law in the means of brighter future and female confidentiality. My advocates as a student of STI is to spread awareness of teenage pregnancy through the use of what I know word empowerment and to ensure that girls have the support they need to reach their full potentials. As a teenager, I believe that early pregnancy is a huge responsibility. We should further educate the youth about sexual and reproductive health, even in non-formal education settings, and normalizing respectful dialogue on the topic, providing the rights-based measures to help pregnant girls and young mothers continue and finish their education, creating vocational training opportunities. Again, teenage pregnancy is only reserved for those people who have enough knowledge and has the capability to provide its family basic needs, people that are mature and ready enough to be a good parents.